men really do care about their health. It's not that men don't care, it's just that men are a little bit awkward about being one-on-one in a room with a healthcare professional. Much more comfortable in a screening setting at a basketball tournament, a hockey game. Even more comfortable probably at work, because men will put on the safety gear and do pretty much anything the boss asks them to do. And so all sorts of opportunities to do outreach for men. So that's kind of grown out of the initial vision, and I think it's just a fantastic piece of the work.
I'm a little bit nervous. Hopefully I'm allowed to still eat greasy foods, you know? I want to be healthier, but I still would like to cheat from every now and then.
So what about our build up the iron and liquor in your system?
Well, that's intense.
We're not going to hurt you.
Are you sure?
You don't want to start thinking about it when you're laying on a bed in a hospital operating room and thinking, well, you know, maybe if I'd known something about what's happening with my body 10 years earlier, I wouldn't be here.
So see, not too bad though, right? It doesn't.
I think I made it through.
Such a simple procedure, it can make a big difference in a person's health very easily.
I'm a man, so I can say this, is that we tend to be a little bit ignorant and not really wanting to find out the numbers that we actually are when it comes to health and screening and things. So this is the way to get the message out, and Northern Health's got a great program coming out that's going to promote those type of things to the north, and we're just happy to be one of the first sites to get on board.
She's my fiance, and years ago she lost a daughter due to diabetes. So, you know, it's something that can cost a life so easily.
I think that often men, like women, don't want to know. They'd rather, in some ways, you don't want to do testing because you don't want to find out you have a problem. And to that, I'd just say, really, problems grow exponentially the longer you leave them. So getting the testing done and finding out you might have results that need further investigation is actually a good thing, because then there's something you can do about it.
I think everybody should have it. You know, even the young people. You know, especially diabetes, where our people are known to have diabetes, they don't know it. This is a good way of doing it.
In particular for men, they're working long hours. The traditional hours of access to health services are limited, so setting up services at times and places that are convenient for men is a huge factor in success in getting them in for testing.
I've learned from a sociologist that I encountered in this process that men use something called ironic teasing a lot. You know, they put each other down. They will talk kind of in an edgy way to each other. Obviously, we don't always use the best language. So a principle of health promotion is use the language of the people you're working with. So that's part of what we're trying to do here.
Are you man enough? Man enough to play dress up with your daughter?
You look like the princess.
Man enough to take a check in hockey? Man enough to buy your wife what she needs from the pharmacy?
Is this everything for you?
Man enough to unplug the toilet with your bare hands? Then you're man enough to see a medical professional for your health needs. Check out men.northernhealth.ca for more information.